Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers the RN roles at local, state, and national public health levels. By the end of this lesson, you should be able to define public health nursing, and local, state, and national roles for RNs. You should be able to identify the trends in public health nursing. You should be able to describe examples of public health nursing roles. You should be able to discuss emerging public health issues that affect public health nursing practice. You should be able to describe collaborative partnerships for nursing. You should be able to identify educational preparations for public health nursing and competencies necessary to ensure practice. And you should be able to demonstrate understanding of team concepts in public health settings. Nursing in the community is the practice of promoting and protecting the health of populations using knowledge from nursing in social and public health sciences. So you're looking at three different sciences. You're looking at the nursing science, the social sciences, and you're understanding the public health science. Many of the epidemics of the future will be defined by social problems such as substance abuse. It's important for a nurse to be able to understand that. Public health nursing Nurses can address society issues by evaluating problems and then determining what can be done to change the system and fix the problem. We will first quickly describe RNs in public health, but then we'll go ahead and describe RNs in public health at the local level, at the state level, and at the federal level, so you have a pretty basic overview of what RNs are doing in public health. There are several competencies that a public health nurse needs to have to practice. A public health nurse needs to develop analytical skills that are really good at assessing both individuals and aggregates. They need to have basic public health science skills. They should understand the science of public health. They should have cultural competency skills. They should have effective communication skills. They should have community dimensions of practice skills and financial planning and management skills, leadership skills, systems thinking skills. What is that talking about? They should be able to think about the different systems that support the health of and well-being of an individual, and they should have policy development skills and planning skills as well. What are RNs doing at the local public health level? At local public health departments are responsible for implementing and enforcing local, state, and federal public health codes. That's where it's happening in ordinances that provide essential public health services. If you go back to the lecture last week, we talked about essential public health services. So at the local level, this is where it's being enforced. The goal of the local health department is to safeguard the public's health and improve the community health status. At the state level, each state and territory has a single identified official state health agency that's managed by a state health commissioner. They receive the funding from the federal government to implement interventions such as communicable disease programs, maternal and child health programs, chronic prevention programs, injury programs. All of that is coming from the state level. It's trickling down to the local public health level. They oversee the local public health programs and they delegate the public health powers, such as whether we need to quarantine a certain population. Okay? Let's talk about the federal public health level. That's a powerhouse. That's where it's all coming down. Remember, it's coming down and it's trickling down. They implement the regulations that are formulated by the Congress. The U.S. Department of Health and Human Services and the Environmental Protection Agency are examples of federal agencies that are the most influential for public health at state and local levels. It's important for the RN to understand where it comes from. So it trickles down from the DHHS and the EPA, and it affects us. The DHHS includes the Center for Disease Control, the CDC, the Human Health and Services Administration, the Agency for Healthcare Research and Quality, and the U.S. Food and Drug Administration are all under the DHHS umbrella. I have provided links in the resources. I want you to go and explore and learn a little bit more about these resources so that you understand. Another thing that's important about the DHHS is that they also uh, develop and initiate the Healthy People initiatives. Right now, we are functioning under the Healthy People 2020, and I've also provided a link for you to follow so that you can learn more about the Healthy People. I will not spend a lot of time on the history and trends because we've already talked about it, but it's important to know that a person born today can expect to live 30 years longer than a person that was born in the 1900s. Isn't that fascinating? Medical care accounts for 5 years of that increase, but public health is responsible for the additional 25 years through prevention efforts. So, a lot of public health efforts are going to be about prevention. The Institute of Medicine in 2003 identified the following 7 priorities for public health in the 21st century. Number one, we need to understand and emphasize the broad determinants of health. Number two, we need to develop a policy that focuses on population. Number three, we need to strengthen the public health infrastructure. Number four, we need to build better partnerships. Number five, we need to develop systems of accountability. Number six is emphasizing evidence based practice, which we have done throughout the program. And now, number six is to enhance communication between different agencies and different people collaborating. Public health activities at the beginning of the 21st century were shaped by the September 11 attacks. That's very important for a nurse to realize. Let's quickly talk about the scope and practice standards, just an overview and roles of a public health nurse. Public health is based on scientific core of epidemiology. Marketing of nursing in public health is essential to inform the both professionals and the public about the opportunities and challenges that our population face in public health care. Public health nurses deliver services within a framework of ever constricting resources coupled with emerging complex public health issues. It's important that this is an area that really needs advocacy. This requires the efficient, equitable, and evidence based use of resources. The National Public Health Performance Standards. Uh, Federal, state, and local partnership have developed evaluation instruments that can be used to collect and analyze data on programs. Public health nurses are involved in that. The instruments link to 10 essential public health services that we talked about earlier. Partnerships and collaboration among public health nurses is very important with other groups and other practices. And it's very important to make sure that you have multiple perspectives and you're looking at the population from all different angles. An overview of the issues and trends in public health. A driving force behind the nursing changes is the economy. We need to make sure that we recognize the economy influence on public health and the increase in managed care. Nurses need an ongoing education and training and understanding of what's going on with the economy as it impacts the health of people. Population-based interventions are those that focus on entire populations versus individual-based interventions, and they possess similar health concerns and characteristics that are guided by assessment of health status. You want to consider the broad determinants of health, such as housing, income, education, cultural values, community capacity, and all these different things that influence population outcomes. You will have an opportunity to do a community assessment. You will have an opportunity to do the windshield survey that's going to expound more on that in the coming week. At You want to make sure that as you're taking care of people, you're addressing all levels of prevention, which are primary prevention must be a priority. And of course, you can also apply the other levels of prevention that we talked about. Remember that when we're applying levels of prevention in public health, we're looking at either applying them at the community level, we're looking at applying them at the system level, and we may also apply them at the individual and family level. The Association of Community Health Nursing Educators has established an educational preparation and guideline for community health nurses, and we know that a baccalaureate degree is the most preferred level for a community health nurse. So I hope some of you guys will continue on and get your baccalaureate degrees, and then that way you can become in this avenue can open that for you. Those who have an associate degree are encouraged to seek further degrees. They can be hired in public health nursing roles, but really everybody is encouraged to make sure that they get a further degree because of the increasing complexity of what public health entails. Somebody with a baccalaureate degree will be able to intervene more effectively. As far as national health objectives go, since 1979, the U.S. Surgeon General has worked with the local, the state, and the federal agencies and the private sector, really, and the population at large to develop objectives for the nation to help the nation understand what we need to do as far as populations go to stay healthy. In 2009, the DHHS released the Healthy People 2020. That's where we're at right now. These are objectives that will guide the work of public health nurses over the next decade. We're almost to 2020. It's a good link for you to follow that I provided in the classroom so that you can learn a little bit more. State health departments play a key role in implementing healthy people objectives. Actually, public health nursing is a little bit more complex than what meets the eye. A lot of what you hear may be misunderstood, but some of the roles in which nurses function, they may work in advocacy, which is as an advocate. They may work as a case manager, managing a caseload. They may work as a referral source for specific diseases or specific health concerns. They may work as a counselor. They may work as a primary care provider, providing primary care nursing, and they may work as an educator. They may work as an outreach worker. They may work as a disaster responder. There's a lot of opportunities for public health nursing in the community. Nurses have an important role in helping with local disasters, including planning, staffing, and evaluating events after they happen in a disaster. Thank you for listening into this lesson. I hope this lesson provides you a quick overview of what a public health nurse is doing in the community. There's a lot of opportunities that we didn't expand on, but there's more to it. I hope you've enjoyed this overview and you understand better about nursing roles at the local, state, and national public health level. For questions about this lesson or corresponding notes, please make sure you visit your book to expand more on it. And if you can't get the answer, email me at the address I've provided. Have a lovely day.